Good day, viewers and listeners, and welcome to the COVID-19 update for today, December 3, 2021. I am Godfrey Brooms. Today, we'll continue speaking about the new COVID variant, Omicron, and why Guyanese should be concerned about it.
So right now we have 1,177 active cases. We have approximately 519 persons in Region 4 that have active COVID. And we have right now in Region 6, 248 persons. Region 3, the number has come down significantly, so we have 207 persons in Region 3. So these are basically the active sites where we have cases. We have in all the regions, but this is where we have the most cases. Over the last 24 hours, we would have had 41 new cases. So of the active cases, we have 64 persons in hospital. 50 of these persons are at the Ocean View Hospital, and we have 17 persons in ICU. Well, we should be concerned with any variant that is circulating. But Omicron, from what has been described and what has been discovered so far, we know, for example, that this virus has, this particular variant has more than 50 mutations, 32 of which are on the spike protein. And that's the protein that they generally use to develop vaccines. So the vaccines that were developed to identify spike protein and to develop immunity against that spike protein. And if that spike protein has mutated in a very significant way, then what is postulated is that the antibodies that persons would have produced would not be able to recognize this new spike protein. And that then can lead to what the scientists are calling immune evasion, meaning that the new virus can evade your current immunity. Now, we're not sure, because this thing has only recently been discovered, so no country can say for certainty that there is immune evasion. So because of these concerns, people ought to take precautions and make sure that a couple of things. One, that they wear their mask, especially when they're in public spaces, and especially when they're in indoor environments. So you need to wear masks, observe social distancing, sanitize. These are all things that would help to prevent spread. And if you are going into indoor environments, make sure that it's properly ventilated. So far, from all the findings that we're hearing about, persons would probably experience some amount of fever. They would have runny nose, sneezing. Some people would lose their sense of taste, sense of smell, and so forth. So all those typical signs that we already associate with COVID, those are the typical signs that you have to look out for. Now, there is a variation with if you're unvaccinated, you will have these signs in a more pronounced way. If you are vaccinated, then in some cases, there are people who would not even have any symptoms. And it's not only for the Omicron variant, but for the Delta as well. So there are a large group of people, if they're fully vaccinated, they'll probably only know that they're infected if they go and do a PCR or antigen test. So, as of yesterday, um, we would have given out across the country 736,444 doses of a COVID vaccine, which means that for the adults, we now have given out 402,751 doses. That's approximately 78.5% of our adult population. We would have also given out 281,455 doses. This is second dose to our adult population. That would be approximately 54.9%. In terms of the 12 to 17, we have given out 29,382 doses. These are first doses. That's about 40.3% of that age cohort. And for second dose, it's 20,582 or 28.2% of that age cohort. We have also given out 2,274 booster shots. And as you can see, from when we started, this has been growing constantly.
And this has been the COVID-19 update. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. Godfrey Brooms is saying goodbye for now.